Gynecologists, what is the nastiest thing you have experienced while working? Story 1. I used to work for a urologist, and one night he was on call for the local hospital, and a morbidly obese woman came in with painful urination/hematuria, which means blood in urine. Due to her size, they decided to put her under anesthesia and do a cystoscopy to see if there was anything unusual about her bladder. And once they had her on the table, he said the first thing that hit him was the smell. It was atrocious. He went on to find what looked to be a smashed and rotted sandwich in the folds of her cheeks and thigh area. Once the patient woke up from the procedure, he asked her about it, and her reply was, "Oh yes, I did lose a sandwich a couple of weeks ago. I just thought I ate it and forgot." Before we continue, do us a quick favor, smash that like button and subscribe to support our channel. Story 2. My cousin, now a fully certified EMT, almost ended up taking a very different path. Back when she was in school and still figuring things out, she thought she wanted to become a medical assistant. During her clinical training, she had a chance to shadow some procedures. One of those happened to be a routine pap smear. She was a little nervous but excited to observe, and she tried to lean in to get a closer look so she could really understand what was going on. Enter the villain of the story, the rolling stool. As she leaned in, the stool betrayed her. It slid forward just enough to completely throw off her balance, and before anyone could react, she face-planted directly into the patient's nether regions. The doctor just froze, wide-eyed. The patient, knees up and draped with a sheet, couldn't see what had happened. She only knew that something had suddenly and violently made contact with her area. So, my cousin blurted out, the lamp fell. Everyone stood in silence for a second before the doctor gently helped her up, trying very hard not to laugh. The patient was more confused than anything, and thankfully didn't panic. My cousin finished that rotation, but let's just say she decided very quickly that maybe medical assisting wasn't her calling after all. She tells that story at every holiday gathering now, and honestly, it never stops being hilarious. Story 3. My brother is a gynecologist with the NHS, and every now and then he'll casually drop a medical horror story right in the middle of dinner like it's just another Tuesday. One particular night, he came home later than usual, looking both exhausted and weirdly excited. He had just finished surgery on a woman who came in complaining of vague abdominal pain, pretty standard stuff, until they took a scan and discovered something not so standard. Turned out she had an ovarian teratoma, which, if you don't know, is a type of tumor also lovingly referred to in the medical world as a little monster. This thing was huge, about the size of a rugby ball. But that wasn't the strangest part. It had hair and teeth. Yes, actual teeth. Apparently, in some cases, they can even grow eyes and, according to one of his colleagues, might even respond to touch. The woman hadn't even noticed it growing. She was severely obese, so the mass had gone undetected for who knows how long. My brother said it was one of the wildest things he'd ever seen, and he even asked if he could take a picture and submit it to a medical journal. But the consultant just shrugged and said, "Nah, that's pretty common." So there we were, pushing around our food while my brother described the real-life equivalent of a creepy sci-fi creature growing inside someone. Just your average family dinner conversation. Story 4. My dad is a gynecologist, and he once told me a story that still makes me cringe just thinking about it. He treated a young woman who came in with trichomoniasis, basically an infection that causes this green, foamy, foul-smelling discharge. This condition is not particularly glamorous to deal with. She'd apparently had it for months before finally coming to see him. Of course, my dad prescribed her the proper medication and gave her the whole "take it exactly as prescribed and finish the entire course" speech. Fast forward a few weeks, and she's back in his office. And surprise, surprise, the green foamy discharge is still there. My dad asked her if she had been taking the medication. Her answer was, "Well, my boyfriend really loves it, so I didn't take the medicine." Yeah, she had stopped taking the medication because her boyfriend liked the way it is. My dad says he nearly lost it right there in the clinic. The gagging was so bad he had to step out for a moment just to breathe. Story 5. My cousin used to work as a receptionist at a gynecologist's office, and she swears this was the most chaotic shift she ever pulled. One afternoon, a very pregnant woman waddled into the clinic. She looked like she could give birth at any second. But nope, that wasn't why she was there. She had made an appointment because she wanted the doctor to make sure everything looked camera-ready. Apparently, her husband was planning to record the birth, and she wanted to make sure her presentation was aesthetically on point. So, she goes in for her appointment, acting like everything's chill while clearly doing the pregnant lady version of waddling through a landmine. About 20 minutes later, the head doctor starts yelling for an ambulance. Full-on panic mode. Turns out this woman had been in labor the whole time. She was having contractions on her way to the office, but figured, hey, may as well stop by and freshen things up before heading to the hospital. Long story short, she gave birth right there in the exam chair. If you're timing your contractions with one hand and booking a beauty consultation with the other, maybe it's time to go to the hospital first. Story 6. Both my dad and my brother are practicing OB/GYNs. One day, a young woman came into their office complaining of severe pain and swelling in her lower area. It was bleeding and had a very strong, unpleasant odor. She had just recently become active, and her grandmother had told her to put a potato inside her as a way to prevent pregnancy. I live in the rural South, and unfortunately, some very poor families still believe in old wives' tales like this. Yes, it sounds strange, and most people don't actually do this. But in her case, the potato had started to sprout and was growing inside her. The ER sent her to my dad and brother's office because they had no idea what was going on. Story 7. I am not a gynecologist. I am in the emergency department, but this one definitely falls under the category of things I will never forget. A woman came into the ER worried about a really unusual odor. She said it started about 2 weeks earlier and was getting worse. She couldn't quite figure out what was wrong, just that something smelled off. So, we did a standard checkup and examination, and then she pulled out what looked like a soggy, discolored lump of something that used to be greenish paper. We were confused at first, then the smell hit, and then the story came out. Apparently, about 2 weeks before, she'd been out partying, and in a moment of drunken genius, decided her purse wasn't secure enough for her cash. So she stashed $200 in what she called her second purse. You can probably connect the dots. Well, in her rather spirited state, she completely forgot about it. Fast forward 14 days, and that emergency fund had turned into something unrecognizable and very, very unpleasant. Everyone in the room was pretty grossed out. One of the nurses even had to step outside for a minute. And the kicker is, right after telling us the story, she casually asked if there was any way to clean the money and still use it. So yeah, bartenders, maybe start asking your customers where that damp cash came from before you toss it in the till. Story 8. Not related to OB, but I've got a story from nursing school that still makes me shudder. During a clinical rotation on a respiratory unit, I learned that working in healthcare is definitely not all sunshine and band-aids. I knew I'd deal with some pretty gross stuff, but there was one thing that really turned my stomach: sputum. Not blood, poop, pee, pus, or vomit, just sputum. And on a respiratory unit, there's a lot of it. One day, my instructor had me gear up to suction a patient's tracheostomy. The patient was in a vegetative state, but still had a gag reflex. I managed to remove and clean the cannula without too much trouble, then started suctioning. The patient began to heave a bit, and the nurse reassured me. "It's okay, she does that sometimes. You're not hurting her." So I kept going, but as soon as I removed the suction hose, the patient gave one massive heave. Suddenly, the biggest glob of greenish-brown lunged stuff you can imagine shot right past my face, almost hitting me and splattered all over my instructor's chest. I immediately ran out of the room, nearly losing my lunch. To this day, I am still not sure if I could handle it if it had landed on me instead. Story 9. I worked as a medical assistant at a family practice, and one day a new patient called in, very upset about some lady issues. We managed to get her in the same day. After the doctor spoke with her, he told me to get a room ready for a pelvic exam. When we walked in, the smell was pretty intense, definitely something serious going on. The doctor started the exam, and once her feet were in the stirrups, his eyes went from normal to about the size of dinner plates. She was experiencing a severe case of a herpes infection, much worse than anything I'd seen before. The area was extremely swollen and inflamed, and there was clear sign of infection around a piercing she had, and when the doctor inquired about a tear, she responded, "Yeah, haven't you ever heard of DP?" After the exam was over, we had to convince her that her 4 current partners needed to be contacted about their exposure to several STDs, even though, as she put it, it was too late anyway because she never uses a rubber. I have never seen anything so disgusting in my whole life. It still haunts me. Story 10. Not me, but my mom is a gynecologist, and while she doesn't usually come home with horror stories, there was one case that really stood out. Less gross, more mind-blowing. A girl came in because she hadn't gotten her first period yet, and she was already well into her teens. No signs of anything starting. My mom did the usual checks and ended up ordering a hormone panel just to see if anything unusual was going on. A few days later, the results came in. The doctor who ran the test, a man, called my mom directly and said, completely straight-faced, "She has testosterone levels I sit be proud of." Turns out, the girl had a super rare genetic condition. She was biologically male in terms of chromosomes, XY, but her body was completely unresponsive to testosterone. Like, it just straight up ignored it. So while her body produced it, none of it had any effect. As a result, she developed completely along the typical female pathway, externally and in many other ways, except she didn't have a uterus and therefore never got her period. The condition is called androgen insensitivity syndrome, and it's rare enough that most doctors go their whole careers without ever seeing a case firsthand. Story 11. My friend's wife is a nurse at a sliding scale clinic, and this story has become legendary among us. A woman came in and loudly told the receptionist, "I think I got bugs in my monkey." The waiting room chuckled, but staff took it seriously. After filling out paperwork, she went to the exam room. The nurse asked a few questions and noted that the woman also mentioned a bad smell and discharge along with the itching. She instructs the woman to get ready for examination and says that the female doctor will be in shortly. The doctor, an accomplished veteran, walked into the room and had to walk right out. It turns out that the patient didn't have any sort of crab lice. The patient's entire pubic area was infested with maggots and covered in a thick, unpleasant layer of buildup. The smell was so intense, even the veteran doctor who'd seen everything had to step away. The exam room had to be closed for the day. The smell lingered in the office for a week, and it spread out of the doctor's office and into the hallway. They eventually hired a medical-grade cleanup crew to come in and sterilize the room. Still, the odor lingered in the office for 6 months. What caused all this? Turns out, 7 tampons had been left, and it fused together into a nasty, smelly mass. Definitely one of the wildest cases anyone had seen. Story 12. During my clinicals at a large inner-city clinic, I cared for a woman in her 50s who had recently undergone a vaginectomy as part of her treatment for cancer. The surgery had removed a significant part of her anatomy, and after we removed the packing, there was just an open wound. It was unlike anything I'd ever seen before. What stayed with me the most wasn't the medical aspect, but how deeply she was affected emotionally. She was heartbroken and refused to let her husband see the area. Through tears, she told him he didn't deserve to stay with her anymore. Her husband, overwhelmed with emotion, simply held her hand and reassured her that he loved her and wasn't going anywhere. Story 13. My stepdad is a retired OB-GYN with 45 years of experience. He told me the worst case he ever dealt with was a patient he performed a hysterectomy on just after he finished residency and put the paperwork down he needed for board certification. The examiners noticed that a few days after the surgery, the patient needed 7 units of blood. The examiner was obviously concerned, so my stepdad explained to him that the woman's husband essayed her days after a major surgery and she almost passed away. He still says that's the grossest situation he's ever been a part of. My stepdad saved her life and passed his boards. Story 14. Whenever I hear about women not waiting 6 weeks after delivery to get intimate, I don't think they were essayed, but I think they were coerced. My ex whined incessantly about not doing it for 6 weeks. I still want to punch his stupid face for it. Story 15. My ex coerced me into doing it 4 weeks after delivery. I just wanted to give him a blowy, but that wasn't good enough. After a few minutes, I started crying and asked him to please stop. He got kind of mad and explained to me that he wasn't even putting his whole thing. After his lecture, I had stopped crying, and he spooned me and then immediately started banging again. I just totally shut down. I didn't cry. I didn't ask him to stop. I just died a little inside knowing that he didn't care about me at all. Then, after a few minutes, he stopped and asked me what was wrong. I didn't move, didn't speak, and just wanted to pass away. He got really mad and started yelling at me. I asked him to leave, and he wouldn't leave and just kept yelling at me. I don't feel like he was wrong when he first started doing it with me, because I had non-verbally consented, even though I had said many times that we shouldn't do it now. I really don't think he understood how much I didn't want to because I was down for other activities. If you do it with someone after they have started crying and asking you to stop, you are an essayee. He doesn't think he is, though. I have only talked to one person other than him about this in real life, and I don't know how to deal with it at all. Story 16. I am not an OB-GYN, but my friend's mom is an obstetrics nurse, and she shared a really heartbreaking story. A woman came to the hospital complaining of stomach pains, and during the exam, they discovered she had actually gone into labor, but the baby had sadly passed away and was stuck in the birth canal for several days. The woman said she didn't even realize she was pregnant or that she was in labor. It was a tragic situation, but since the baby never took a breath outside the womb, it was classified as a stillbirth, and there were no legal consequences for the mother. Story 17. A woman arrived in the ER in full labor, shockingly unaware that she was pregnant. She thought her symptoms were related to stomach issues or a virus. She had gained a lot of weight over the months, but assumed it was unrelated. The baby's head was crowning by the time she got to the hospital, and the nurses had to scramble to get the delivery room ready. The mom was understandably stunned but relieved once everything was over. The whole staff agrees it was one of the wildest deliveries they've seen. Story 18. A few years ago, when I was still a medical student, I was doing my primary care rotation and was asked to see a patient who came in with a gynecological concern, discomfort, and persistent itching. She was a morbidly obese woman, and from the moment I entered the room, I could tell something was off. Even before the exam started, a strong odor hit me, sharp, foul, and overwhelming. I tried to power through it, but as I started preparing for the pelvic exam and putting on gloves, I suddenly felt extremely nauseated. My body was giving me every sign that I was about to lose it. So I did what I thought I had to do. I excused myself and told my attending that I wasn't confident handling a complex pelvic exam due to my lack of experience with patients of that size. That wasn't the full truth. The reality was that I couldn't stay in the room without risking getting sick. A few minutes later, my attending called me back in to show me what he found during the exam. At that point, I braced myself for something truly bad. I genuinely feared we were going to find something serious, maybe even a lost pregnancy, based on how intense the situation felt. But what he held up was something unexpected. A tampon. It was a retained tampon, likely left in place for over a week. It was the source of the odor and the discomfort the patient had been experiencing. The tissue around it was irritated, and there was some bloody debris, but no serious complications beyond that. The attending muttered something about the smell being one of the worst he'd ever experienced. The patient was clearly embarrassed and started crying. My heart sank. I felt awful for leaving, for not helping, for not being better prepared to support her through it. I stepped out again, this time not out of revulsion, but because I was genuinely about to be sick. The smell was something I can't even begin to describe accurately. To this day, it lingers in my memory. That was the moment I quietly decided I probably wasn't cut out for OB/SAMUI. Not because of the patients, not at all, but because I knew I couldn't stomach situations like that on a regular basis. You learn a lot about yourself in medical school, and that day I learned where my limits are. Story 19. I am not a gyno, but when I was in Puerto Vallarta for spring break back in 2007, we were hanging with these girls that we met at our hotel. The first night we met them, we all decided to go to a club together because there was a huge foam party going on. So anyway, we get to the club, there are 9 of us, 4 boys and 5 girls, and before we know it, my buddies and I each have a girl and we are all dancing. A couple of hours go by, and the girls start to worry about their friend, the 5th wheel, because they haven't seen her in hours. We start searching for her for hours and hours, and before we know it, we have the police and half the town looking for her. It starts to get late, and I still have no word on her. It turns to 6 a.m., and we decide to go to sleep, and the girls stay up. We guys head back to our rooms, and right when we get there, we get word that the missing girl was dropped off in front of the hotel she was supposed to be staying at, and the people who dropped her off sped away. She was taken to the hospital because she could barely do anything. Come to find out, they found 7 different toys put in her pot. What a nightmare for her doctor. That was terrible. People can do that crap to someone. I wish I could beat those people up. Story 20. One time, a woman came in with a massive abdominal mass that was so large it looked like she was 9 months pregnant. After lots of tests, the gynecologist discovered it wasn't a baby at all. It was a giant ovarian teratoma, basically a tumor made up of hair, skin, and teeth. Apparently, it had been growing for years. When they removed it, they found it contained tangled clumps of hair compacted so densely it looked like a giant hairball. The patient was mortified, but also fascinated. The whole team joked that it was basically a real-life monster in her belly. The operation was long and messy, and the smell in the OR was unforgettable. Story 21. A woman came in complaining of severe burning and irritation. Upon examination, the doctor found chemical burns inside her canal. She confessed to a cleansing ritual where she'd been using a harsh antibacterial soap internally for weeks, thinking it would prevent infections. Turns out the soap was too strong and had caused burns and breakdown of the tissue, leading to a nasty infection. The patient was shocked when the doctor explained that her cleaning was actually doing serious damage. Healing took weeks, and the patient had to stop all her DIY hygiene experiments. Story 22. I am an OR nurse. One night, I was called in at around 2 a.m. for a general surgery emergency. Pretty vague, but I was working in a city with a large population of military personnel and substance users, so late-night calls like this weren't unusual. When I got to the hospital, I was told the case was a perirectal abscess. For those unfamiliar, That means there was a painful infection near the rear end, essentially a buildup of pus and inflamed tissue that needed to be drained. Let's just say our whole crew collectively sighed. These cases are unpleasant at best, and in the middle of the night, even less appealing. I went down to the ER to transport the patient. As the ER nurse handed over the chart, she smirked and simply said, "Have fun with this one." In healthcare, vague statements like that are rarely a good omen. My patient was a woman in significant pain, shifting and moaning, muttering prayers, and clearly in distress. She was disoriented, and I could barely get her name out. But once I confirmed her identity and what we were dealing with, I focused on getting her prepped for the OR and under anesthesia. She was extremely anxious, moving around a lot, and almost fell off the table as we tried to sedate her. In my experience, many chronic addicts with chronic pain or substance tolerance react strongly, sometimes dramatically, because standard pain medications barely work for them anymore. Now our team that night was experienced. I'd been in healthcare for years. The second nurse had over a decade of trauma experience. The anesthesiologist had trained in a level 1 trauma center, and the surgeon was ex-Army, stoic and stone-faced. We'd all seen a lot, but none of us expected what happened next. Once the patient was asleep and secured in stirrups, I began cleansing the area. It was clearly inflamed and leaking slightly, but nothing out of the ordinary. The surgeon stepped up and made a small incision. At that exact moment, the patient had a muscle spasm, a common occurrence under anesthesia. And then, everything changed. What we didn't know was that the infection had traveled deep, nearly a foot inside her abdomen, creating a massive internal pocket filled with pus, necrotic tissue, and intestinal leakage. When the incision was made, the internal pressure released all at once. It erupted with such force that the fluid sprayed across the room. We all wear full protective gear, gowns, gloves, masks, hats, but none of it was enough. The nearest wall was over 7 feet away, and yet by the end of it, there were spots of contamination as far as the eye could see. The patient, still unconscious, began experiencing more involuntary spasms, and with each twitch, more of this awful fluid was expelled. Within minutes, it had reached the floor and soaked into the other nurse's shoes. And she says Pruzid Schreiz was in trying to comprehend what I was witnessing. The second nurse was dry heaving into her mask. The surgeon was practically standing on tiptoe to avoid getting more of the fluid on himself. Then came the smell. I've been in some gnarly situations, but this hit like a wall. One nurse vomited into her mask and had to run out of the OR. The anesthesiologist, a tall, athletic guy who looked like nothing could faze him, started gagging and threw open the OR doors just to breathe. It hit me next. I had my mouth open in disbelief, and it was like I could taste the air. My body physically refused to inhale. I had to step out. We have a trick for situations like this, a small bottle of peppermint concentrate. Every OR has one. You dab a little inside your mask, and it helps mask the smell enough to function. But when I went to grab it, the box was empty. Someone had used the last of it and hadn't replaced it. So I did what I could. I grabbed a vial of Nastiest, an adhesive we use sometimes for dressing wounds. It has a strong, sharp scent, not peppermint, but close enough. I rubbed it inside my mask and re-entered the battlefield. The anesthesiologist did the same. We later realized inhaling Nastiest like that can give you a mild high. Honestly, it's probably what got us through. By this point, the smell had traveled. The hallway outside the OR reeked. The nurse who ran out was still at the sink, trying to recover. 1/3 of the OR floor was now covered in a thick mixture of fluid and tissue, and there was no way to stop it. The surgeon kept going, silent, steady, focused. He scraped out the infected tissue and flushed the cavity, piece by piece. I stood by him, stunned by what we were dealing with. It felt like a war zone. The floor looked like something out of a horror film. It was surreal. We eventually finished. We packed the cavity with gauze, dressed the wound, and transferred the patient to recovery. She made it through the surgery. Afterward, I took what's known as an alcohol shower. 70% isopropyl alcohol. It's the only thing that can even begin to cut the smell after something like that. I used 4 or 5 bottles, and honestly, I briefly considered drinking it. I didn't, but I get the temptation now. The surgeon, usually silent, looked at me afterward and said the only truly negative thing I ever heard him say in all our years working together. That was bad. The next morning, the entire floor still smelled. The cleaning team said it took over an hour just to suction everything off the floor. The OR suite was closed and quarantined for 2 full days. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You haven't seen stuff, kid. Story 23. When I worked as a medical assistant in a gynecology office, the worst patient we ever had was actually really sad. She clearly hadn't bathed in about a week, and her underwear was visibly soiled. She said she was having trouble getting pregnant, had frozen eggs, and wanted a pelvic exam. But when she took her pants off, the smell was overwhelming. It was hard to stay in the room. As I was helping her, she started talking about how she knew how to get rid of a man and get away with it. She even told me she could help me out if I ever needed it. I am fairly certain she was struggling with mental health issues. It was disturbing, but also deeply sad. Then there was another time we had a 98-year-old patient come in with severe uterine prolapse. It was hard to see and made me genuinely scared of getting old. Story 24. My wife isn't a gynecologist, but she's a nurse practitioner, and part of her work includes performing pap smears and pelvic exams. One day, a patient came in and said something was wrong. She said the odor from her lower region had been getting worse over the past week. She was visibly embarrassed and admitted she couldn't figure out the cause, only that it smelled bad and wasn't going away. My wife did an exam. She used a speculum to get a better view, then grabbed forceps, and sure enough, she found a retained tampon. Apparently, the patient had been intimate near the end of her period and forgot it was still in there. My wife said the odor was one of the worst she's ever experienced in her career. And that says a lot, because part of her medical training involved working with a university cadaver that had been preserved for over 30 years. Anyone familiar with embalmed cadavers knows that sweet, meaty smell they carry. But she said this was worse. Story 25. My dad is an OB/GYN with a small, close-knit staff he's worked with for years. His receptionist is a real sweetheart, salt of the earth. One day, a middle-aged man came up to her at the front desk and asked if he could schedule an appointment for his 19-year-old fiancée. The receptionist politely asked what the visit would be about. Without missing a beat, the man said, "I am getting married soon, and I am well endowed. I just want to make sure she can handle me." She was mortified. She quickly called my dad over to hear what the man had said. My dad calmly replied, "Sir, the best way for your future wife to stay healthy is to respect her choices and remember that she's still young." Story 26. Back when I worked as an ER nurse, I saw more than my fair share of, let's say, memorable pelvic exams. Some of them were pretty routine, others not so much, but if you've ever wondered what true chaos looks like, missed pregnancies are where it gets real. There were cases where the patient didn't even know they were pregnant until they came in with cramps, and by the time we checked, things were already in motion. We used to have these little plastic containers about the size of one of those giant tubs of store-brand ice cream, and yeah, sometimes that's what we needed just to manage the aftermath. The physical and emotional storm in that room? Hard to describe. But if we're talking about the smell factor, oh boy, there are a couple of contenders. Every so often, someone would come in feeling a bit off down there. After some gentle questioning in an exam, we'd discover they had forgotten about a certain hygiene product that was supposed to be changed regularly. Let's just say it had well overstayed its welcome. The moment we realized what it was, the smell would hit you like a brick wall. You'd think you were ready, but you weren't. You're never ready. The ER teaches you a lot, but mostly, it teaches you that human bodies are full of surprises, and not all of them are the good kind. Story 27. My uncle is a practicing gynecologist in Montana. Over the years, he's seen plenty of unusual cases, but one story he shared with me has stuck with me, not because it was graphic or horrifying, but because it was just surreal. A woman came into his clinic, complaining of persistent discomfort and pressure she'd been feeling for years. As he asked questions, it became clear she'd been carrying this issue, both physically and emotionally, for a very long time. About 5 years earlier, during a moment of experimentation, she had used a wiffle golf ball, the small, hollow plastic kind with holes. Unfortunately, it got stuck. Feeling embarrassed and unsure of what to do, she never sought medical help, hoping it might resolve on its own. It didn't. When she finally came in, things had progressed in a surprising way. Her body had started to treat the foreign object as if it were part of her. Over time, the soft tissues had actually grown around and enclosed the wiffle ball, kind of like how trees slowly grow around fences or signposts if they're left in place long enough. My uncle described it as something you'd expect to see in a medical oddities textbook. The object was fully embedded, making surgical removal a real challenge. But they managed to get it out, and she recovered. What stuck with him most wasn't the object itself, but how fear and shame had kept her from seeking help for so long. It was a reminder that sometimes people don't need judgment, they just need support. Story 28. I was the patient, not the gynecologist. This is more funny than awful, but I didn't appreciate it at the time. When I was in college, mid-80s, I went to the student health center for my second OB exam. The female GYN who had done my first one was on vacation, so I was being examined by the male GYN on staff. Everything was fine until he informed me that he was doing a rectal exam. I didn't know that rectal exams were a thing, so I was pretty shocked to say the least. A more serious event occurred while pregnant with my first child. My water broke when I was at 35 weeks, on a Friday morning. My contractions were 5 minutes apart. My husband drove me an hour to the hospital. They examined me, and because there was blood mixed with the amniotic fluid, which messes up the litmus test, and my cervix wasn't dilated, the docs concluded that I was just incontinent and sent me to discharge myself, a 10-minute walk through the hospital. I've been peeing all my life, and this ain't it. They were kind enough to allow me to leave my heavy overnight bag in the room, so I didn't have to carry it. When I got back, I'd been clenching hard to keep from leaking fluid down my legs as I waddled through the hospital halls and rushed past the nurse who was cleaning up for the next patient and released at least a cup of amniotic fluid laced with blood into the toilet. She looks at it and says, "That's not pee." No joke, Sherlock. She then proceeded to read me my discharge instructions, which included, if your water breaks, if you start bleeding, or if you have contractions closer than 5 minutes apart, return to labor and delivery. At this point, I was pretty pissed. I told her that I was having all of those right in front of the doctors, and they were sending me home. This was around noon, and all of the doctors were off to lunch. So I went home and spent the weekend on the toilet, having contractions and leaking amniotic fluid. The next Tuesday, I went in for my scheduled OB appointment. The nurse didn't want to even examine me because the baby was breech, and the slightest touch sent me into contractions. She just wanted to schedule an excursion for a few days later. I finally had to tell her to please examine me because the stuff leaking out of me was beginning to smell infected. Looking skeptical, she pulls on some gloves and grabs a glass slide to collect a specimen. One look at it, and she started looking really grim. "You are not leaving this hospital until you have this baby." Then they put me on Pitocin for 8 hours before realizing that I was simply not going to dilate and did an emergency C-section. My daughter was born 5.5 weeks early, but was perfectly healthy, just tiny and slightly jaundiced. During the C-section, the docs realized that I have a bicornuate uterus, which prevents me from ever dilating. No matter how strong my contractions get, the muscles aren't shaped right. Oh, they also screwed up my epidural and sprayed blood all over the hospital room trying to get it in. Told me not to look in that direction, like I couldn't tell what was going on. Thank you for watching. If you enjoyed this video, be sure to give it a thumbs up, subscribe, and hit the bell icon so you never miss an update.